My name is Jonna Carroll. I'm a physical therapist over at Good Samaritan Hospital, and I primarily work with patients who have had strokes. So I'm here today to talk about strokes and what everybody here knows about strokes, and kind of give some information about how to prevent them. So every 45 seconds, somebody in the United States has a stroke, and it's the third leading killer in the United States, which is pretty big, considering that there's a lot of people. So does anybody, I like this to be a little bit interactive. Does anybody know what a stroke is, or have had somebody that they know or themselves have had a stroke?
Yes, my aunt had a stroke.
Okay.
More than one.
Yeah. Well, I'm sorry for them, but and I don't know how many people are on here. But yeah, so if you don't know what a stroke is, it's basically a lack of blood circulation to the brain where the brain cells fail. So it can be caused by a blockage or bleeding, and those are the two different types of strokes. There's the ischemic stroke, where something is blocking the blood vessel, preventing the nutrients to get to the brain, causing the brain cells to die. And there's the hemorrhagic stroke, where the blood vessel bursts and there's blood going everywhere inside of the brain, which causes the brain cells to die as well. The most common type of stroke is the ischemic stroke. About 80% of strokes are ischemic, and those can be caused by several different things. Usually it's a blood clot or some junk like fatty tissue or something like that going into the little tiny arteries, causing it to block off and the blood not be able to get to the brain cells. And it can also be caused by stenosis, where either by lifestyle or by hereditary, those vessels are just smaller than normal. And then hemorrhagic strokes, they happen when the blood vessel kind of tears and then blood is just kind of bleeding into the brain space where it's not supposed to be. And this is usually caused by high blood pressure. And it can also be caused by aneurysms, which are often caused by high blood pressure. And they tend to present like a very sudden, severe headache, like the worst headache you've ever seen. Like the worst headache you've ever felt in your life. That would be the sign of a hemorrhagic stroke. And strokes are a medical emergency. So no matter which one you're having, you want to get to the hospital right away. Does anybody know any signs and symptoms of a stroke?
A loss of balance, droopy lips, face droop,
Yeah.
Arms that are not, when you stretch them out, that you can't keep them even. And what else? I can't think of anything else.
Slurred speech, is that one?
Yeah, that's one. Yep. So one of the things that we use to help us remember is be fast. B is for and all of these are a sudden change. B is for balance, so a sudden change in your balance. E is for eyes, a sudden change in either your vision, or your eyes are kind of moving all over the place, or your vision's getting dim or something like that. F is for face, which you got, either facial or eye drooping on one side, usually one side of the face. A is for arm or leg. So strength, sudden change in strength of the arm or the leg. S is for speech, which you got. But just a little note about speech. It could be that somebody's slurring their words, but it can also be that they're confused. They're not making much sense. They're kind of saying jumble. Even though they're saying words, they could be just not making too much sense, or they may not be able to talk at all. They might not be able to remember words, things like that. So it can be more than just, slurred speech. It could be more things other than that. And T is for time. So T is what I was talking about. It's a medical emergency. It's very important to get to the hospital as soon as possible. And then just some other danger signs that can happen with strokes are a double vision. If you all of a sudden you're getting double vision, drowsiness, and nausea or vomiting can be signs of strokes as well. So why is it important to go to the emergency room right away if you're having a stroke?
It can decrease the severity, I think, if you get there timely.
Yes. So particularly if you're having an ischemic type of stroke, there are certain medications that they can give you that are clot busters that can prevent the damage to the brain. But those medications can be only used if it's a certain amount of time after the stroke has started. So, if all of a sudden you notice either a friend, family member, or yourself having any of the symptoms right away, you want to look at the time and see what time it is when those started. And sometimes these can happen when somebody's asleep. So you want to note the last time that person was normal, like acting or normal, so that you can tell the person at the hospital when it started. There are certain medications that they can give, like I said, that they're clot busters, but if you're on certain medications, you can't get those. And if it's outside of like a 3 to 4 hour time limit, they can't give them to you. There are exceptions, but in general. Now, when you are having any of the symptoms, you want to call 911 and get transported to the hospital. Generally, if you're in an emergency vehicle, they call ahead to the hospital. And what we hear in the hospital is code stroke in the emergency room. And what happens is that there are tests that they have to do to determine if it's an ischemic stroke or a hemorrhagic stroke, because the treatment of those two things is very different, even though the symptoms can be the same or similar. So they call that code in the hospital, they clear the scanner so that person goes straight into the scanner, so that we know what kind of stroke it is and we know how to treat it the best way. A lot of times those hemorrhagic strokes might need emergency surgery, whereas the ischemic strokes, they have these medications that if given within a certain amount of time, it can reduce the brain death. It's kind of cool how far medicine has come. It really has made a huge difference in the way patients end up in the long run. It makes a big difference. But if you start having symptoms and you don't go to the hospital right away, they can do some things, but not those really good brain saving things. Any questions about that so far? Okay, so has anybody heard of a transient ischemic attack? Does anybody know what that is?
No.
Okay, So a TIA, transient ischemic attack, it's similar to a stroke, okay? It's symptoms of a stroke that last a short amount of time. So usually 24 hours or less. If that's happening, you should go to the emergency room because those are your warning signs. Let me see. Where's that statistic? Looking for a statistic that I have. Oh, 2/3, here it is. 2/3 of people who have a TIA end up going on to have a full stroke. And so if you might have had a TIA, you want to get worked up because there are things that they can do to prevent that stroke from happening. It's a very high risk that you're going to have a stroke if you've had a TIA. And you don't want to ignore. And it can be caused by a temporary blockage of the arteries. So sometimes when you have like a thrombus or gunk in your arteries, it can kind of block, but then kind of unblock a little bit, but something's still in that artery. So it's likely that in the long run, it'll end up causing a stroke unless it's addressed. So there are things that they can do. They can put little stents in the arteries to prevent that from happening. But if you don't go to the hospital or the doctor and kind of get that assessed, you know, that stroke is probably going to happen. So for those of you who know people who have had strokes, what kinds of things are they living with now? Do they have problems with one side or the other, their arms or their legs, their balance? What kind of things have you seen?
Inability to walk.
Okay. So many people can have trouble with walking because of a stroke, and could be because of weakness on one side or the other, but it could be because of coordination problems. And some people who have had a stroke can walk a little bit, but they need a little bit of help from either a cane, a walker, or a brace on their leg. And some people after a stroke need to use a wheelchair to mobilize. And some people have doing difficulty tasks such as bathing, dressing, and doing activities of daily living, managing their own medications, managing their bills, things like that. And they might also have some communication problems in the long run. So either they're still slurring a bit, or they forget words often, or they might even have some language deficits where they'll, say the wrong word sometimes. And sometimes after a stroke, swallowing can be a problem. So if you look at somebody who's had a stroke and they are walking, you can notice that their coordination on that one side, or their, grip or movement of their arm is different. The same thing can happen with the muscles in the throat that help you swallow. So sometimes after a stroke, swallowing can be a problem, and sometimes those patients need to be on an altered diet. They may not be able to have thin liquids. Their liquids might need to be thickened, but it really depends on the person. It depends on a lot where in the brain that the stroke is. So not everybody who has a stroke is going to have all of these symptoms. Some people have pretty much just one arm affected and they can walk just fine. Some people, can't really speak very well and they can't really walk really well, but they can use their arms okay. It really depends on where in the brain that their stroke was. And that's why all of the symptoms are so different, because there's different areas of the brain that control different things about your body. One thing I don't think I mentioned, sometimes people can have difficulty with toileting, their like bowel and bladder function, or getting to and from the toilet can be a problem as well. So what can we do to prevent strokes? What I'm going to talk about now is risk factors. There are plenty of risk factors that we can do something about to prevent us from having strokes. There's also risk factors that we can't do anything about. The risk factors that we can't do anything about are our family history. Like if our parents had strokes, grandparents had strokes, that's part of our family history. We can't change that. Increase in age can increase the risk of strokes, but you can have a stroke at any age. My youngest stroke patient, I think, was 12 years old. So you can have a stroke at any age. It's not just an older population problem, but it does happen more often in the older population because they have had their risk factors for longer. A prior history of stroke. So if you've had a stroke in the past, you are at higher risk of having another one. African American or Latino heritage does increase the risk of strokes. But what I really want to get to is the things that we can do things about. So does anybody have any ideas about what risk factors are for having a stroke? This is tricky. I'll go ahead and start. So I mentioned this earlier, is high blood pressure. So if your blood pressure is high, it puts more pressure on the arteries and it can weaken them, or it can cause the blood to clot a little bit more, or it can cause the things that are lining the arteries that are not supposed to be there, like the cholesterol. It can force those to become little, they can go off and clot, cause more clotting, and cause an ischemic stroke. So high blood pressure is a risk factor in both ischemic and hemorrhagic strokes. And that's one thing that we can do something about. Who knows what your blood pressure should be? What is a good blood pressure?
I
120
think
over
it's
60
less
or
than
80?
less than 130.
Yeah.
And less than 80.
Yes. So 120, I got two answers there. 120 over 60 is perfect. They had recently kind of changed their parameters to lower. So it used to kind of be more like 130. Now they're saying more like 120. But yeah, 120 over 60 is great. So how do you know if your blood pressure is high? One thing that we suggest anybody doing, and I personally have one myself, is a blood pressure monitor at home. Because when you go to the doctor, it's once a year, maybe twice a year, usually once a year. They take your blood pressure and that's it. But your blood pressure can vary. It can vary during the day. It can vary, morning, afternoon, evening, and it can vary based on what you're doing. So we suggest getting a blood pressure monitor, monitoring it different times during the day and kind of writing it down and seeing if there's a trend. And if it's good or if it's over those parameters consistently. It is normal for your blood pressure to go up a little bit with exercise, but you would still want to, tell your doctor if it's going up. So the next thing I'm going to talk about is diet. So your diet can have a lot to do with your risk of stroke, particularly eating really high fat diet, lots of cholesterol in your diet, because those things over time kind of get stuck to the walls of your arteries and can fly off and cause these embolisms, causing a stroke. So eating low fat, low cholesterol diets, and also salty foods. Salty foods can increase, my computer. Okay, there we go. You guys didn't see anything, but my computer just, so salty foods can be a problem as well. If you're diabetic, it's very important to control the blood sugars as best as possible. Really high and really low blood sugars damages the arteries from the inside out, which is really bad because it increases your risk of stroke. If those vessel walls are weaker, you're more likely to have a hemorrhage or to have a thrombosis as well. So has anybody heard of atrial fibrillation? Does anybody know what that is?
I think it has to do with the heartbeat.
Yeah. So normally your heartbeat's very coordinated. It goes ba-jump, 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 right? But atrial fibrillation is the first one is going and it's not, it's going really fast, but it's also not squeezing very hard. So it's going and what happens is where it's not squeezing all the way out, that blood is sitting there. And what can happen if blood sits in a spot? It clots. It starts to clot. And what can happen is that once that heart beats better again, that clot can be thrown both into the heart and cause a heart attack or into the brain and cause a stroke. So if you know that you have atrial fibrillation by going to the doctor yearly and monitoring your heart rate. So when you take your blood pressure, it can monitor your heart rate as well. So if you know you have atrial fibrillation, you have to be on those medications to prevent you from having a stroke. That is something that you can modify. And the sooner you know about it, the more you can have that managed. So exercise is one thing that has been found to be neuroprotective. It protects your brain. You're less likely to have a stroke if you are a routine exerciser. And if you do exercise and you do end up having a stroke, your prognosis is a little bit better. You're going to have a little bit better of a recovery than if you weren't. So anything that you can do for exercise is great. Both strengthening and aerobic exercise are fantastic. The best thing that you can do is find something that you really like and do that as best you can. One thing that can help people is finding another person that likes what they like and motivates them and kind of get you in a routine and have some accountability to do the exercise, because it is very good for your body and it's really good for your brain. Smoking. Smoking is a really high risk factor for stroke because it increases the thickness of your blood, and it can increase how much it can clot. So particularly, that's particularly a problem. So if you smoke, trying to quit as best you can. I know it's hard, but that will reduce your risk of stroke, as well as alcohol and illegal drugs also increase risk of stroke as well. I've kind of already talked about high cholesterol with the poor diet, with your diet changes that you could make. And what a lot of people don't know is that if you didn't eat any cholesterol, your body makes all of the cholesterol that you need. So you're going to have some cholesterol, but if you have really high cholesterol, again, I was talking about kind of if you eat a lot of fatty foods, that cholesterol can kind of stick to the side of the arteries and build up over time, ergo ending up causing a stroke. And I think that's it for those risk factors. Any questions about those? No? Okay. So some of the things that we can do for prevention, I kind of already went through with the risk factors. I kind of explained some of them. I'm just going to review them again. So staying active, don't be a couch potato. Eating fresh fruits and vegetables will help. And avoid eating heavily processed foods only. Obviously, you're gonna have a snack every once in a while, like you're gonna have a treat every once in a while, but try to really focus on those healthy fruits and vegetables. And if you're gonna eat protein, you wanna do leaner proteins to reduce the amount of fat and cholesterol to prevent you from having a stroke in the long run. And it's, everybody has some cheats, but kind of balancing the fruits and vegetables against the cheats. Because those cheats, all the stuff that increases your risk of stroke, it tastes really good. But just kind of putting it on a balance will help you. So when you go to the doctor, especially for high blood pressure, and you're on medications for high blood pressure, those medications are something that you're gonna probably have to take for the long term. They reduce your blood pressure short term, and if you stop taking them, your blood pressure goes back up. So sometimes people will, take their blood pressure medication, see that their blood pressure is good, and then stop the medication, and that's when they have a stroke. And it's heartbreaking. We see it all the time because they think that their blood pressure is good because the medication brought it down, so they stop the medication and then they have an incident. You want, especially if you're on blood pressure medications, you definitely want to be monitoring the blood pressure and write them down and bring them to the doctor when you go, so that they can make sure that the medications you're on are working well enough and not too well sometimes, and monitoring that blood pressure daily. Let me just see if there was any. Yeah, I think that was most of what I had. Any questions about that? Okay. I usually don't get done this early. I usually get lots of questions. Does anybody have questions in general?
You covered it quite nicely.
Okay.
Would it be possible to get the new updated BP cards that I could get some for the senior centers?
Let me ask. I'll have to ask Stacy.
I did send her an email. I was just checking because the ones I have when we came back are now, no good because the parameters have changed.
What did they say, 130?
They were the old ones. Yeah, they weren't the new ones.
Okay. I'll have to ask her.
I appreciate it. Thanks.
Yep. So I think there was, I do need to eventually just get, so do you guys have more people in one room, or is it just the 5 or 6 people?
It looks like Victory Villas left. So
Okay.
they've done that before where there's been 4 or 5 in a room. Yes.
Okay.
They take advantage of the virtual for small groups.
Yeah, which is fine. I just have to write it down on my thing. So MedStar at Good Sam, which is where I work, we have a specialty certification in stroke rehab. So our program is inpatient. So after if you have a stroke, you go into the hospital. After you're in the hospital, they just, they take a look at you and see if you can go home, which some people can go home. And some people need so much help that they have to go into rehab first. So that's our setting. So that's where I work. I work inpatient with patients who have strokes. And we have speech therapists, physical therapists. I'm one of the physical therapists, and we have the occupational therapists. And we work as a team with the doctors and the nurses to help people get as good as they can get. So hopefully I never have to see any of you in here, but you know it exists. If that's it, that's all I have, if nobody else has questions.
I thank you very much, and especially on Valentine's Day.
Oh, yeah.
Thank you.
No problem. I hope it was helpful.
Very
Yes.
helpful.
It was.
Thank you, Jonna.
No problem.
Have a good day, everyone.
Bye. Happy Valentine's Day.